Bob Murphy. I'm the Executive Director of the Havey Institute for Global Health and the John Philip Fair Professor of Infectious Diseases and also Professor of Biomedical Engineering here at Northwestern. Thank you for taking the time to join us this afternoon for our latest installment at our new time for the Havey Institute's seminar series, Global Health Education. Please take a moment, if you haven't already, to follow us on Facebook and Twitter at #FSM Global Health. In addition, we welcome you to become an Institute member to receive access to specialized resources and services that support the research infrastructure. For more information, please visit our website at globalhealth.northwestern.edu/members, and please sign up. Today, we are thrilled to have Dr. Ashti Doobay-Persaud join us. Ashti is Associate Professor of Medicine in the Department of Medicine, Hospital Medicine, and Medical Education. She's Director of the Section of Global Health in the Division of Hospital Medicine. And she's co-director of the Center for Global Health Education here at the Havey Institute. She's founder and director of the McGaw Global Health Clinical Scholars Program for graduate medical trainees. She's faculty director of the Masters of Science in Global Health graduate program at the School of Professional Studies in conjunction with Feinberg, and a core faculty member in Global and Community Health for the Medical School and Internal Medicine Residency Program. As an active member in the Consortium for Universities in Global Health, CUGH, she has served and led on various education-related committees and was awarded the prestigious CUGH Hall-Sewankambo Leadership Award. Congratulations. And she's a member of the Bellagio Global Health Education Initiative. As a leader in the field of academic global health education, she serves as an academic editor for the PLOS Global Public Health and a guest editor for Pedagogy and Health Promotion, and has led and is a lead editor in the upcoming issues of Frontiers in Education. Throughout her work, Dr. Doobay-Persaud has become a national and international expert and leader in global health pedagogy, particularly ethical practice and competency-based curriculum development. And she's now collaborating with international partners to support locally driven teaching, learning, and training with academic partners, including training in the fields of palliative care, simulation-based education, and faculty development. There will be time after the presentation for questions, and we welcome you to submit your questions, and we ask that you do it through the Q&A feature in your Zoom at the bottom of your screen. I don't put it in the chat box, please put it in the Q&A box if you could remember that. Put it in there and I will be reading the questions. And now, Dr. Doobay-Persaud, I turn it over to you and welcome.
Thank you. Thank you so much, Rob. Thank you all for the opportunity to share a little bit about the Center for Global Health Education today at the seminar series. So we do a lot of different things at the Center for Global Health Education, but what I wanted to share with you all today are our key initiatives at the center. I wanted to tell you a little bit about them. I'll give you a little bit of a background about global health education. You heard a lot about me already and the programs I run. I will still give you a bit of an overview of that. And then I'll share with you our sort of culminating event at the center through our key initiatives. I do want to take a moment to acknowledge that Northwestern University sits on the original homelands of the Council of the Three Fires, the Ojibwe, Potawatomi, and Odawa, as well as the Menominee, Miami, and Ho-Chunk nations. And we acknowledge this history, and we recognize the dedication and importance of culture to the lands and communities with whom we live, learn, and work. So, a bit about global health education. So, I'm going to give you sort of the brief history. So what global health used to be about 10 or 15 years, 10 years ago, 15 years ago when I started, it used to be international medical electives, and people were sort of going all over the world and doing a lot of volunteerism, volunteering abroad without being properly trained. And it was a bit of the Wild West around then. And over time, there's been a lot of progress that we've made. But at that time, a lot of issues were flagged around the idea of medical missions and particularly short-term missions. So the unintentional harms that come from practicing outside of your scope or in unfamiliar settings, doing things abroad that you wouldn't do at home. And that's particularly salient for those in the medical field, since we do have a fairly large scope of practice. Burdening host members who have a lot on their plate as well and have to sort of manage our students. The idea of the savior complex that comes up quite a bit in the colonizing medical elective space. Issues of sustainability with a lot of these short-term electives or short-term programs. Fungibility of resources. So some people say, why buy a plane ticket when you could donate that money? Differences in cultural norms, differences in standards of care. And these were just some of the many issues that were flagged over the last 10 years. We've done some work in the area, and one of our studies around practicing outside scope of training was actually featured in that in this NPR medical missions helpful or harmful, because there are a lot of roles that we can play if we do things well. But we know that global health, particularly in many different spaces, is well known for being an area that has a lot of good intentions, but a lot of unintended consequences. And that's really across the board, from aid to volunteerism to durable medical equipment. These are well known to many of you in the crowd. However, in the 2010s, a movement came afoot, and that movement was really around ethical practice. It was around best practices in training. The World Medical Association actually came out with an ethical standards for global medical electives. Global health ethics for students particularly was called out. And standards actually were a set of standards were actually put forth by a number of groups. And here are some of them. And the standards are really around standard of care, safety, service, and sustainability. So that students should be learning primarily. If they're doing service, it should be supervised. We should learn about the context of where we're working, language, social, cultural, political, historical. Very clearly, do not practice beyond your scope of training, as that is one of the biggest harms that you can do in this practice. We teach our students to recognize and respect different ways of treating and managing illness. Respect for the Western pillars of biomedical ethics also comes up. And so those are things like justice, non-maleficence, beneficence, etc. Cultural humility as a principle was one of the main behaviors that was highlighted as important for students pursuing this work. And then, of course, meeting all licensing and ethical standards as put forth by both the sending institution, the host institution, and any countries that you're traveling to or are licensed in. So particularly, I want to draw your attention to this group, this team, Drs. Pinto and Upshur, and they actually published this in 2012, 2013, and that was kind of at the beginning of the ethical movements for international electives for residents and medical students. And here they actually came up with a couple of principles or ways and behaviors for students for doing this work. And they proposed humility, introspection, solidarity, and social justice. The first two really being behaviors: humility, listening to others, getting guidance from other people who know more than you do; introspection, examining everything you do closely, including your motivations, your consequences. And in this, their seminal article on this, they actually wrote out a number of questions. There are about 16 questions that a student can ask themselves before they go on a rotation to see what their motivations are and what the benefits may be and who accrues the benefits. And even if that's just recognizing that it's the student that accrues a lot of benefit from learning, that's still part of their work. Solidarity and social justice are really the kind of underpinnings of why we do what we do in global health. But really, other than the weight guidelines, the guidelines I showed you before, this was a sort of biggest set of principles and ways of thinking that came out in the sort of 2010 time when all of this was coming to fruition. So when I came to Northwestern, when I was in medical school, I did these short-term global health electives, and I did short-term global health electives in residency as well. It's why I chose my residency. And then when I came to Northwestern, international medical electives were being pursued. And in fact, at Feinberg, the engagement in medical student electives was much higher than at the national average. And a lot of that was due to the Center for Global Health that was kind of born in 2009. And that's the precursor to the Institute. And you'll see the big jump in engagement that happened when the center was born. So when I came, I was able to engage in transferring some of these principles of ethics into the pre-departure training for the medical students. And right now, the pre-departure training program for the medical students includes seminars by IGH faculty and staff, actual logistical training. We do ethics modules and safety modules. They actually have extra safety and security supports through the Office of Global Safety and Security. And we do include reflections, introspections, and debriefing. Of note, our numbers are picking up. They're almost double what they were last year, and we'll see that kind of play out over the next couple of years. I think we all know why this big dip happened when travel restrictions occurred. So when I started, this is one of the main areas of programming, bringing the ethics over to the medical student space and supporting the work the center was already doing. And then, I similarly in residents also are able to do short-term electives in global health. And so along with some colleagues, we designed a program for residents and fellows so that they could lead, support, and deliver safe, ethical, and equitable care in global health. This program is for residents. It has core lectures, specialty-specific lectures, peer journal clubs, asynchronous web-based modules, simulation-based medical education, and an global health experiential component. And then finally, a scholarly project that's presented at Global Health Education Day. We have had 74 residents graduate from our program. We have had about 136 participants. As you can see, they cross all specialties, and we have mentorship support throughout. Another flagship program that we offer at the Center for Global Health Education is our Master of Science in Global Health. And this is an asynchronous online program that is that is really geared to interdisciplinary professionals, particularly those in the non-clinical space. And so students have to take the 8 core lecture or the 8 core courses that you see there in the middle, global health leadership, foundations, biostats and epidemiology, et cetera. They can take one of the elective courses that you see in these purple boxes. They can choose up to 3 of them. And then they take the practicum, which is the field experience, which I am an instructor in, along with my colleagues, Dr. Galvin and Dr. McGivern. So the newest addition to the program is our new elective in planetary health. But this is setting the stage of what kind of programs we run at the Center for Global Health Education. So those were all the programs that were happening. And then we became an institute. And when we became an institute, all those different programs and work came together under the Center for Global Health Education. We also crossed campuses from the Feinberg campus over to the Weinberg campus, and we co-direct the center, myself and Dr. Leonard. And we offer different programs and different threads within CGHE. So for our leadership, Dr. Galvin is our associate director, Dr. Fant, Neubauer, and Grothaus are our assistant directors. And I mentioned some of the programs we run: the McGaw Global Health Clinical Scholars Program, the Master of Science in Global Health, the Feinberg program, and any other kind of clinical programs. But we also have a sort of dotted line with our colleagues who implement the undergraduate global health studies program, the MPH program, and the accelerated public health program. And throughout, as we've sort of built as a center, we've started to engage in activities that thread across the center and that really kind of unify and leverage the different programs, courses, and faculty throughout the center. And so our two kind of main cores have been our curriculum core, our research core. And we also offer a trainee advisory committee that was created in the last year that Dr. Van Genderen runs, and a community of practice that Dr. Neubauer runs. So a bit about our center in terms of specific goals. So our strategic goals are really, like I said, ethical, equitable partnerships grounded in humility and social justice. That's one of our main jobs. Another main job is really to promote academic global health education. So thinking about global health education as a field of research, practice, and scholarship that is part of academia. We are committed to providing programming across the educational continuum so that we do create a pipeline of learners, hence our crossing across the campuses and the ages of learners and degrees of learning. And as I said, we're really, partnerships are really important to us. They're kind of central to our work. And so our future goals are really around nurturing bidirectional, equitable, and sustainable partnerships that will support the global health workforce. So this is our main vision or mission. And I have up here Dr. Galvin and Dr. Leonard, who are our leadership. And what we just, what we kind of talked about, and we came together as a group, we said we really want to build and cultivate partnerships with our peers in education at LMIC academic medical centers. We feel pretty good about how we train our students and our trainees. Now we feel like we have some robust ways to ensure ethical practice and that they will be leaders in the field. We want to move forward and really start to cultivate partnerships with in the space of education. And so that's sort of the direction that our center is going and growing. And we were able to do this through focusing on faculty development. So faculty development really, for lack of a better term, this idea of like capacity building that comes up a lot. I think that it's, buzzwords sometimes get taken out of context, but really we want to be building educational capacity. That's truly where we want to be. And we believe that training faculty who will then train the future global health workforce is the best sort of way to do this. And because we became an institute and we are a center, we've been able to fund innovative programming through philanthropic awards and intramural awards. And we've been able to grow this partnership and faculty development across institutions. And so that's the background of where I wanted to bring you to, which is our Key Initiatives project. And so we launched the Key Initiatives project in 2021. And the overall aim of the Key Initiatives project is that it should provide benefit to our learners, our partners, and our programs overall. And we just wanted to build the educational capacity at the center. to start, we wanted to see, like, you know, we've done small evaluations and self-studies over time, but we wanted to get a sense of, like, what is our impact across all these different programs we've created? Where are students going? What are trainees doing? What kind of impact are we making in the global health space and the global health workforce field? We really wanted to work on strengthening our academic partnerships and faculty development, and that's certainly where you know, a lot of our hopes and our aims lie. And we wanted to provide, you know, we knew that we've done fairly well in our programming, but we want more opportunities for our students and our faculty, and we want even improved opportunities around global health ethics, because the field has improved and the field has changed. And we think it's time to sort of look at everything again and see how we can kind of make that ethical safety work even stronger and more robust for the students to do before they travel. So the Key Initiatives project is coming this year. It's coming to a close. It's been a 2-year cycle. As I said, we started in September 2021 and we'll be finishing up in August. And I'll just share a little bit about our initiatives, and I'll share along the way some of our short, medium, and long-term outcomes. I would love to hear what you all think about it. So the way we split up the project, or the Key Initiatives sort of proposal, was that we split it up into 3 projects. The first project really centered around curricular innovation and evaluation. And we created a team that was a curriculum core and a team that's an evaluation core. Everyone you see up here is a team lead. There are even other people involved, but this is the leadership that's been involved in each of these projects. Our second project, which you know, I am particularly excited about because I do sort of the most in that space now, is the academic partnerships, innovation, and strengthening work. We have a big team there, and you'll hear a lot about those projects. And then finally, the faculty, trainee, and student development strengthening work. And so we'll talk a bit about our partnership in global health hospital medicine. I am a hospitalist, and I actually chose the field so that it would align best with the work that I do in global health. And then we'll talk a little bit about our education incubators, our skills development for our faculty. We're starting a program there. And then finally, the area for our medical students, which is really the pre-departure training and curricular expansion. So we have one very quick win in our curricular innovation and evaluation project. Our big gap that we noted when we did our gap analysis was that we didn't have a planetary health course. So we've implemented that this quarter with a colleague from Planetary Health Alliance, and it's just finished up. So that's our first short-term outcome success. It's very straightforward. And the next one is really around evaluation and the evaluation core. So we need to evaluate all of our programs comprehensively, and we started with MSGH. And what we did is we evaluated 5 years of MSGH program data to look at success, impacts, gaps, and really to evaluate how our students learn with our practicum experience. So I'll pause for a moment there and just describe our practicum. So many Master of Science courses have a thesis or a capstone. Ours is specifically a practicum where our students have to add value to one of our partners' projects through a practical experience. And we evaluated the practicum and the outcomes from the practicum as a bit of a surrogate to see how our students were doing in the program. So Sarah Welch was the lead on this. And this is a sort of short table that shows you our evaluation questions and what we used. So the first box is really demographics. And so we used enrollment records. We asked students for their CVs, and we also asked them to tell us a bit about their personal skills. So we use that. And then we have a pre and post assessment on competencies that were endorsed by CUGH. So we have students do a self-assessment on that. And then the preceptors also assess our students, and then our students assess themselves. So we have sort of 3 areas of assessment in the practicum. And then this team we created a survey that was sent to alumni to capture what they're currently doing and what their contributions are in global health. So some select outcomes, the team prepared the survey, sent it out, prepared like a enormous report for every data point and question. We're currently taking all of these items and either improving the program with it. We have a manuscript that's being put together. But some select outcomes, what we learned about our students were that more than half of them are working in global health, and over half of them are working with marginalized populations. The majority of fields that they're working in, and this is of the respondents from our alumni survey, they're working in public health, health science, and healthcare. Many of them are in leadership positions. It was really important for us to understand if our practicum is helpful, if it is achieving the goals we hope that it would achieve. And graduates sort of on their own in an open text box described the practicum or field experience as very impactful for their learning and growth. And then the majority of graduates felt the program was a high quality global health education program that assisted with their professional development. However, they didn't feel, about 20% of them didn't feel that the program prepared them well enough for a career in global health. And so for that last note, I'll share that we just started working with the Northwestern Career Advising Group, and we've started a career advising program with that group for our Master of Science students. I think the first session is April 12th. So we just engaged with them, and that was born out of these findings as a way to improve. So the partnership assessment team. So that the team has a couple of goals. The big goal is to assess and revitalize educational partnerships at IGH. The short-term goals were actually to create a partnership assessment tool, sort of survey for educational partners. The plan was to conduct interviews and then implement these suggestions. And Dr. Galvin was the lead on this first one, particularly the partnership assessment tool. Sada and Kate created a assessment tool that is between the different institutions that we're sending to where we're sending our medical students. So this is the educational partnership assessment tool. So using these key principles about mutual partnership, host community defining activities, sustainability, compliance, humility, sensitivity, respect, and accountability. So you'll see these are very similar to what we ask our students to do, but this is in a partnership level. A tool was created that was then meant to be deployed. And so this is the partnership assessment tool, and it's an actual script with questions. It was built using the USAID STAR partnership assessment tool, as well as our own reflective praxis tool from ARC, which is our community collaborative in research at Northwestern. So using these different tools, this terrific assessment tool was put together. And sort of what happened is it became very clear the first time. I was the first one to deploy it with colleagues at Messena. And it became clear that it was a little bit awkward, a little bit too formal, and people were kind of too busy to sit down and go through each of these questions. But it was a really great starting point. And I'll tell you a little bit about what came out from that later on. What happened though is we used this as general fields in the end that we'd want to learn about from our partners, things like resources, benefits, deliverables, etc. But it became clear that what we should really be doing is investing more time as Northwestern on a systems level with groups that already do this work. So Advocacy for Global Health Partnerships have put together a broker declaration with a lot of different partners who really are committed to improving short-term engagements in global health and making sure they're appropriate and ethical. And we did sign on to the brochure declaration last year. What we decided to do was to shift our efforts from doing the partnership assessments into implementing the principles of the brochure declaration at Northwestern. And so Dr. Galvin, Dr. Fant, and Kate Klein, our administrative director, are now going to be more heavily engaged in this work and also ensuring that we do what we said we would do as signatories to this declaration and truly advocate for ethical partnerships in global health. And so then our next project, which is project 3, is really about faculty development, training, and improving the pre-departure curriculum for the medical students. And so I'll describe a little bit about global health and hospital medicine and strengthening that space and those faculty opportunities, and also give you a bit of a background on what we do there. The skills course and education research incubators. We don't have time to go through every single thing that we are doing in the key initiatives, but I would like to point out that nearly every survey or assessment tool or curriculum that we discuss today or that we look at all in at CGHE, we've been running through these educational research incubators. And Dr. Drain is the lead on that. And what that means is that it's really an open space. We have sort of a skeletonized slide set where educators can ask questions about their curricula, about their research, and get very specific, detailed feedback about improvements in a space that's shared with others. And so we all learn together through these research incubators. And this group also did an assessment around faculty needs, and so have developed a skills course that will be implemented this summer in the areas that global health faculty would like to have to improve their skills so that they can turn out global health education research and curricula that are that align with the best practices. And then finally, the pre-departure training curriculum expansion was one of our big priorities. It's been a big priority for the last 5 years or so. So we were able to implement that in our project 3. So a little bit about global health and hospital medicine. Dr. Stecker and Dr. Millay here are the ones who are running most of the clinical show and a lot of global health within our division. Hospital medicine doctors can do shift work, and that is a pretty common reason that you'll see a lot of interest in global health and hospital medicine. And we partnered with a clinic in Belize providing primary care since 2012. And we've had 11 hospitalists go there, and they're frequent returners. So out of those 11, different people have gone back 4 to 5 times. And so it makes it a little bit of a longitudinal primary care clinic. It's the same people going back. And I've definitely seen patients that I've seen before at that clinic. Everyone has to go for 4 weeks doing this clinical elective. They do receive pre-departure training now from Dr. Stecker and Dr. Mule. We have had a focus on palliative care in Belize, but now have a larger global health hospital medicine focus on palliative care that I'll mention in a moment. And through this work, we've created a lot of opportunities for trainees. So actually, in clinical care, the medical students who rotate at Hillside kind of get their spots because the hospital medicine doctors precept. And so that's part of an agreement we had a long time ago. We've created scholarship for several students on their AOSC projects, and certainly the Global Health Clinical Scholars projects. And then we partnered, this group, Dr. Mule and Dr. Stecker have partnered with the Ryan Center for Primary Care and worked on some quality improvement projects. And so those have been around in POCUS, which is point of care ultrasound to diagnose pneumonia, and as well as point of care testing for diabetes care. And the Global Health Hospital Medicine Exchange Program has been going on, and we have faculty who've been still going back and forth, and we resumed this year, and we've had two faculty who have gone recently, and it continues to be an important part of the global health hospital, about an important part of the hospital medicine program. And then in hospital medicine, palliative care is a section of hospital medicine. So I do want to highlight the contributions of our palliative care doctors with our implementation of our end of life and palliative care curriculum with our colleagues in Nigeria, with Dr. Ann Ogbena being our main PI, and Dr. Hauser and Dr. Ogunsetan providing a lot of the curriculum and teaching, and Dr. Drain helping with the evaluations. So that curriculum that Dr. Hauser put together a long time ago was adapted, was adapted by the Lagos team and delivered, and we were able to train about 30 providers who had maybe only 70% of them had previous knowledge in palliative care. And so we've been able to do that within the division as well. So knowing that all of these things have been happening in global health, we put some time and effort into growing this global health hospital medicine opportunity section and teams through the key initiatives. And what the doctors on the team did, Dr. Ogunsetan, Stecker, and Mule, they surveyed all of our hospitalists to understand what their interests were, what their barriers were to pursuing global health. And there was a survey done in 2013, that was a national survey that was really around the same topic. What are global health hospitalists interested in? What are they doing? Who are they? So the group started that internally, and then started quarterly meetings for all of the hospital medicine, all of the hospitalists interested in global health. We've had several different hospitalists participate in the projects I mentioned, the POCUS and QI projects. We have a new website that features all the global health hospitalists and what they're doing, and that's ready to go. And then, as I mentioned, the palliative care projects being sort of another flagship of our work. And this picture is staff at Hillside learning on each other how to do point of care ultrasound. And it's funny because this is our hospital medicine clinic. And then this is our assistant director, Dr. Fant, who's one of our simulation experts teaching that group. So there's a lot of cross collaboration through the team that's been built at CGHE. So our next steps, this is last week at the Society for Hospital Medicine Conference. This is the special interest group in global health. We kind of came back together as that group last year. So we introduced the idea of our survey to this group, and we're hoping to launch it nationally, kind of to redo that survey that was done in 2013 to determine what is the landscape of global health and hospital medicine and how can we support its growth. And then so these are the that's the short-term outcome that we got the surveys and the results. And then the medium term is we're launching this survey, but our long-term goal is to develop a global health hospital medicine fellowship. And when I say long-term, I'm hoping actually maybe within the next year or so. And so that's me kind of talking about it at SHM. And the aspiration here is that the Division of Hospital Medicine would partner with the Center for Global Health Education at the Institute, and we could provide fellowships for global health hospitalists who could improve the space. And because we have so many different areas of work now, they could really choose to focus on QI, palliative care, medical education, learn how to work clinically, and learn how to perform ethically informed global health scholarship. So that's really developing a lot of faculty opportunity. And then kind of circling back to where we started a little bit, I think one of the principles of introspection is always sort of stopping and looking back in global health. Are there unintended consequences? Do we need to improve our training programs? Are we meeting the highest ethical standards we want to meet? So Dr. Van Genderen and Dr. Groothuis took it upon themselves to review the pre-departure training and the pre-departure curricula, try to align all the programs, and then expand the pre-departure training program. So what did they do? They reviewed 5 years of student feedback, and that's every single student has to turn in free text about there's a survey and there's a lot of free text about their experience, and there's one entire section that's all around ethical challenges. So they reviewed all of those. They reviewed the published literature for the kind of most up-to-date guidelines on how you teach this stuff. And they recommended quite a few changes that were very specific. They wanted us to improve the foundation in global health ethics to help students recognize and manage ethical dilemmas and to better understand their roles and their goals. And they also suggested very specific interactive educational activities and debriefing throughout the program for students. And so those will be implemented hopefully within the next year or so. We're working with the central administration to support those next improvements. And I put this here to just say that we've really been working on improving these training programs. But what we did for the partnership strengthening and pre-departure curricula is I did deploy some of the work that we had done. So I ended up using the partnership assessment tool. So we've been working with colleagues at Maseno University in Kisumu, Kenya. And we've been very successful through some of our grant programs and project awards in implementing simulation-based medical education, particularly faculty development. So that's what we've used over time. And those grants ended, and we were looking, we wanted to ask our partners, okay, this is kind of a good time to talk about what does partnership look like in education across 2 academic medical centers. So I went to Kisumu armed with my document and sort of tried to find a good time to deploy it. And there wasn't really a good time, but I ended up, when I was sitting, in a car from the hospital on the way to the vice chancellor's office, sitting next to the associate dean, I ended up sort of going through these different questions and sort of like scribbling, on the back of a piece of paper what the answers were. And ultimately it became clear that applying the partnership tool was going to be very challenging, a little bit awkward. And what came out of my conversations with the vice chancellor, on that drive, the vice chancellor was very clear, regardless of what, we sort of had to offer. He really wanted an MOU with Northwestern, and he wanted a Department of Medical Education to be established at Maseno University. So that conversation was had in 2022. And since then, we've been working towards those goals. So very recently, we were able to launch the medical education conference between Maseno University and Northwestern. And this was like a first step to medical education teaching and faculty development. And the leadership at Maseno really helped create the agenda, helped recruit all of the speakers. And we worked with the simulation center that we'd been working with for some time to create this conference. And so this is what I'm so excited to share with you all in the last minutes of this talk, is our medical education conference that happened at the beginning of March, nearly a month ago. So 2 days of full programming happened, and I'll go through some of the bios of our speakers very quickly, because I just want to highlight what sort of how expert they were and how much was taught and learned. So all of these topics are kind of the hot topics in medical education: e-learning, assessment, curriculum development, etc., and simulation. So I'm going over the speakers with you just because I want to highlight a couple of things. So Dean Ogendo opened the session, and Dean Ogendo is the dean of the medical school. He has a master's in medical education. He gave the opening talk, which was medical education, where are we now? And it was a history of medical education in Africa, and then specifically in Kenya. It was terrific. Professor Nyabundi, the vice chancellor, gave the opening remarks. They are both very much looking forward to coming to Northwestern and learning about building departments of medical education. Dr. Wagaki, her topic was e-learning. She's the e-learning coordinator at KMTC, which is the Kenya Medical Training College. And she actually is in charge of more than 90 campuses doing e-learning across Kenya. Dr. Opondo taught about mentorship. And this is something to highlight because Maseno is one of the few academic medical centers that has a very dedicated mentorship program in East Africa, and it's brand new. And then Dr. Okelo, he's bolded and highlighted and underlined here because he's one of the local organizing committee. He heads the Sim Lab, and he's the president of the Kenya Society for Anesthesiologists. And he's done a few medical education fellowships. And his topic was the 1-minute preceptor, which is a kind of common medical education topic. Dr. Guerre is the chair of OB, and he did an assessment topic using MSFB and OSATs. Those are very specific for simulation. Dr. Omoto, bolded and underlined, is the associate dean of medical education, and he helped plan the whole conference with us. And he spoke on OSCEs and how to use OSCEs for evaluation. And then Dr. Kailani spoke about developing high quality MCQs. He works at Moy for AMPATH. And the final topic was the final workshop was a manuscript development workshop, and Professor McGaw is the chair of physiology at Maseno University School of Medicine, and Dr. Morgan is a former McGaw Global Health Clinical Scholar and a former Fogarty Fellow who is now working at AMPATH and a mentee. And so having these two do that final workshop was tremendous. And then before all of that, we had a pre-conference on simulation-based medical education. Also, Dr. Colleen over here, who did one of the pre-conference workshops, gave a talk on curriculum development in medical education. We had our colleague from hospital medicine, who is a simulation-based medical educator. She and Dr. Luwate from emergency medicine came together and put on an ACLS workshop. We had been asked for 3 years to provide this workshop, and we were finally able to do it. And so there's a really great demand for ACLS training for many reasons. But the audience was really terrific. Paramedics, nurses, physicians, residents, and physicians. And they did a 4-hour modified ACLS training. And then here's the sort of Northwestern and Maseno Global Health leadership team, including Dr. Colleen, myself, the Vice Chancellor, Dr. Omoto, and Dr. Ogendo, the Dean and the Associate Dean. Sort of like an informal outcome is the Dean of Medical Education stayed for the entire conference and was very engaged throughout. One of our sessions was to make a declaration. And so we came together as a group, and I was a scribe, and everyone came to consensus that this was one of the first medical education conferences in Kenya. There are a lot of technical conferences, but this is one of the first medical education faculty development conferences. And so the declaration is really that medical education is critical. It should be established as an area of focus, and a committee is going to be created from the conference that starts with a community of practice and then will eventually grow to the Department of Medical Education that our colleagues have been excited about. So just another small outcome, there were 70 participants at this conference from 9 different institutions. I don't have it up here, but 2/3 of the faculty who were speaking were from across institutions in Kenya. One of our next steps is launching a medical education scholars program at Maseno. And so we did a quick needs assessment at the conference, and we discovered important topics, learning modalities, and cadence for our scholars program that we're hoping to launch in the fall. And as a sort of like wrap up of what we were asked to do and outcomes of our partnership, we were asked to create to sign a memorandum of understanding, and we were able to implement that through the help of IGH. We were able to implement the medical education conference, the first step in faculty development. Our next steps are scholars program and designing and implementing this Department of Medical Education. At the conference, we were able to share this opportunity, which is a special collection around global health. And we have 3 different groups from the conference working on manuscripts to submit to this journal that I am guest editing, this section on global health education. And then sort of finally, to bring it all the way back around, we're excited to share that Global Health Education Day is coming up, and that those two people I mentioned who do ethical work in global health and are the first sort of authors in the space. Dr. Pinto and Upshur will be giving a keynote address. Our colleagues will be doing a mentorship workshop on culturally inclusive mentoring in global health. And then I want to say thank you to the team of global health educators who make everything happen at our Center for Global Health Education. Thanks.
Ashti, thank you.
I'm out of breath, sorry.
A little bit over, but that's okay. If anybody
right.
has any questions, you could pop them in the Q&A chat box there. I don't see any questions. Maybe just one kind of global question. First of all, thank you very much. I mean, it's just amazingly impressive what you've been able to do with you and Bill have been able to do with the center. I mean, it's just incredible. So where do you see this going in 5 and 10 years from now?
I mean, I would love if we sort of, MEPI is the wrong word, right? Because that reminds people of PEPFAR, but I would love to be like the center of medical education partnerships, like that we grow that's our space. We partner with academic medical centers, we grow educational capacity. And we have so many people with so many talents. I feel like one of the things we could do is really like match make, simulation, we could match make, palliative care, we can match make, ultrasound, we can match make. What else can we match make to develop educational capacity? And I think it's, these departments of medical education, maybe we can catalyze growing them across academic medical centers if that's what people want.
That's great. We're out of time. We're right at the top of the hour. Thank you very much. Thank you, Ashti, again for your great insight and expertise, and congratulations on everything you've done. It's been just incredibly successful. Thank our audience for joining us, and for well, Bill has a comment saying thank you, great, Ashti. But we invite you to join us next month for our next seminar. This time seems to work out much better than the other time because we had quite a few people join us today. Thank you for joining. On May 3rd is our next one that will feature DK Oji. He's a doctor and lead investigator in cardiovascular research unit at the Department of Internal Medicine and Faculty of Clinical Sciences at the College of Health Sciences, the University of Abuja in Nigeria. He's a consultant physician in cardiology there. Again, thank you for joining us today. For those of you who have registered, a recording of the webinar will be shared by email. And this concludes today's webinar right on time. Thank you all very much. Thank you again, Ashti. Great job.